If you're experiencing pain in your lower back, let's face it, that's not all that uncommon. Many people experience low back pain at some point in their lives. And most of the time it goes away on its own within a few weeks or months. But if the pain's interfering with your ability to function normally, it's time to get help. In this video, we're going to talk about some of the signs that you should seek medical attention for your low back pain, such as the pain radiating down one leg, numbness and tingling in one leg or foot, weakness or loss of balance. My name's Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. As I said, back pain is extremely common. Fortunately, for most people, it gets better in a few weeks. Now, it can be caused by a number of different conditions and injuries. It can be a muscle strain or some other minor injury to the back, but sometimes the pain is caused by something more serious. Nerve pain or weakness in the leg could be a sign of a herniated disc. But again, it's not always easy to tell. Numbness or tingling in the foot or toes could be a sign of sciatica. So if your back hurts, you might want to try steps like this. Take ibuprofen or anti-inflammatory medications as recommended on the package label. Rest as much as possible until the pain goes away. Again, if it does, maybe you go for gentle walks every day if this doesn't make things worse for you, because it can be a good idea to avoid anything that's particularly stressful, like lifting heavy weights or maybe running. Nerve pain or weakness in a leg can be a sign of a herniated disc. A herniated disc occurs when the soft gel-like material inside the discs pushes out through an opening and it gets between two vertebra presses on one of the nerve roots. Maybe you get a herniated disc from a fall, maybe lifting something heavy, maybe twisting your back. Again, a herniated disc may cause pain that radiates down one leg, usually not both legs. You may feel this pain only when you're standing up or when you're walking around. Eventually, you may start to get that pain even at rest. You might notice weakness in one leg, especially your ankle or your foot. And that can be a worrisome sign of a herniated disc, especially if that weakness is getting worse gradually over time. If you have any of these symptoms, in addition to low back pain, it can be important to seeing a doctor. Numbness and tingling in the foot or toes. If you experience that, again, it could be a sign of a disc problem. That herniated disc material can put pressure on the nerves coming out of your spinal column, resulting in numbness or tingling in a particular area of one of the lower extremities. If you're concerned about your back injury, especially with any of those symptoms, talk to your doctor. That doctor can help you figure out what's wrong and recommend treatment options that might be right for you. If necessary, they may refer you to a specialist who can provide additional care. Again, if your back pain isn't getting better after a few weeks, it's important to see a doctor. They can do tests like X-rays or MRIs to determine the cause of your symptoms and how to best treat it. I'd love to hear your experience with your low back pain. Leave those in the comments below. Just realize I can't offer you specific medical advice, but I'll try to answer your question in a future video. Also, make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start my next live stream, including my Ask Dr. Geier live shows. Thank you so much for watching. I look forward to helping you feel, look, and perform better than ever.